be a gross understatement to say we're all eager for the pandemic to be over. And as public officials across the country roll back safety measures even further amid a decline in cases, hospitalizations, and deaths, including here in Boston, where parts of the city's mask mandate will lift on Saturday, it can start to feel like it already is. That includes the Biden administration's new approach to the pandemic, which focuses on getting Americans back to their normal routines, as the president declared during the State of the Union earlier this week to a largely maskless crowd. But as Biden also pointed out, this does not mean we can put COVID behind us for good.
And thanks to the progress we've made in the past year, COVID-19 no longer need control our lives. And if Congress provides the funds we need, we'll have new stockpiles of tests, masks, pills ready if needed. I can't promise a new variant won't come, but I can promise you we'll do everything within our power to be ready if it does.
His new plan focuses on prevention and treatment for people who do end up catching COVID, while getting back to indoor dining, entertainment, and visiting family and friends largely mask-free. That includes a new test-to-treat program that would let people get tested at a pharmacy and go home with the antiviral pills on the spot if they're positive. Also, greater surveillance of the virus through programs like wastewater testing, as well as boosting COVID vaccine development and manufacturing in the U.S. and sending shots to countries that need them. On top of that, officials are also considering dropping mask requirements for airplanes by letting the current mandate expire later this month. But is this the right call, and is this the right time? I'm joined now by Dr. Sabrina Assoumou, Assistant Professor of Medicine at Boston University School of Medicine and an infectious diseases attending physician at Boston Medical Center, and William Hanage, an Associate Professor of Epidemiology at Harvard's Chan School of Public Health and a member of the school's Center for Communicable Disease Dynamics. Bill and Doctor, it's great to see you both. Thanks so much for being here. I appreciate it.
Good to be with you.
Doctor, I know it's hard to generalize, but is this wave of removal of mask and vaccine mandates the right thing to do right now?
So I think we're heading in the right direction. If you look at the numbers, our test positivity rate, in Massachusetts is less than 2%. So all the indices are heading in the right direction. So it is time to start thinking, we're heading into the law. Is it time to start removing some of those requirements? But we still need to remain cautious. If you look at boosting, even in Massachusetts, we've done a really good job, but there's still a lot of room. We also have the less than 5-year-olds who are not yet vaccinated. So I want to say that it is good to start thinking about this, but we still need to remain cautious because there's still room for improvement.
I think it's fair to say, Bill, that we had the governor on the radio show today, and when he was talking about this wastewater analysis, he sounded pretty positive. Here's Governor Baker.
We were one of the first people to actually start using wastewater to track COVID, because you can track the velocity of the growth and the velocity of the decline. It usually runs somewhere between 5 days to a week and a half ahead of what's actually going on in the community. And our wastewater currently sits at testing rates that we haven't seen since July, which is very encouraging.
Do you find it to be very encouraging, to use the governor's words, Bill?
Well, he is formally speaking correct, and I should state up front that I am on the scientific advisory board of BioBot, the company that does the wastewater monitoring. Mm-hmm. I think that it's important to remember that we can get a lot of information from this. And one of the things that you can see is that in recent weeks, it has plateaued. It dropped very, very, very quickly, but now it is plateaued. And if we start making these changes, we can be pretty sure that giving the virus more opportunities to transmit will lead to the virus taking them. So, we're in a pretty good place right now, and I'm, reasonably qualified optimistic. On the other hand, I think we can already see the changes that have been happening over the last few weeks are having an impact.
When I look at the daily statistics, Bill, staying with you for a minute, and I see on the national level, there's still roughly 1,700 deaths a day, which is a shocking number as we approach 1 million, which is even more shocking in total. I'm assuming the vast majority of those who are dying, and again, I'm not minimizing it, are unvaccinated or unboosted. Is that correct?
Yeah, it is. Well, it is very important to remember that the less, if people who are not vaccinated become infected, their risk of severe outcomes is vastly, vastly greater. We do see, sadly, some deaths among people who have been vaccinated, but that's not terribly surprising because there's a lot of people who have been vaccinated. And, sometimes rare things happen in very, very large numbers. But this is most serious if for the unvaccinated population, that's correct. And like you just heard, we could do a lot better at getting boosters out to the over 65s in Massachusetts. The state is not particularly well vaccinated in that regard. And those are the individuals who have really been suffering the last few weeks and months.
Doctor, can we talk about masks for a couple of minutes? Whenever we bring up mask mandate removals on the radio, virtually every single one of our calls is from a parent who's got a 5 to 11-year-old who mentions right away, well, that Pfizer vaccine for 5 to 11-year-olds is not very effective at infection prevention for that age group. Or a parent of somebody under 5 who says, we don't even have a vaccine. What do you say to those, I think, legitimately concerned parents, Doctor?
Yeah, this is actually not an abstract question. I have a 3-year-old and I have a 6-year-old. So this is exactly applicable not only to what advice that I give, but what I am actually following. So, the studies that we saw that came out of New York State were, disappointing in terms of when you think about infection. But the key message is, first of all, to underscore that the vaccine is still really good at preventing severe disease. So that was very encouraging. But what these findings were reminding us is that it's going to be so important to still have a layered approach. Get your child vaccinated as soon as possible, but still use those layers, meaning masking at certain times. And we have to evaluate when are the times that we should still be masking.
Bill, I want to talk to you about who else should be considering keeping their mask on, even if the mandate is gone. But first, I want to play for you a bullying governor of Florida when he is talking to some students at the University of South Florida about this issue of masking. This was yesterday.
You do not have to wear those masks. I mean, please take them off. Honestly, it's not doing anything, and we got to stop with this COVID theater. So if you want to wear it, fine, but this is ridiculous. All right, well, it's good to be at USF.
A nauseating imitation of a poor imitation of Donald Trump by Governor DeSantis there in Florida. Feel free to comment on that, but putting that aside.
Yeah, it's profoundly unhelpful. I mean, he also contradicts himself saying, feel free to do it if you want to, but know that if you do, I'm going to be bullying you. So
exactly.
Again, not very helpful. You can tell he's not a public health professional.
I think so, nor is his Surgeon General, if people have seen Florida's Surgeon General on TV. Who should be seriously considering keeping a mask on at this time, Bill Hanage?
Well, of course, we do have to remember there are large numbers of people within the country who remain vulnerable, either because they're older or because they have comorbidities or are immunosuppressed. Fortunately, we can help those people by giving them good quality masks. So when I say that, I mean things like a KF94 and N95. 2 procedural masks, one layered over the other, will help. And I think that it's really important that we normalize mask use so that we don't kind of point out at people and say, oh, you look weird, you're wearing a mask. Well, they might have a good reason for wearing a mask. It could be something as simple that they're trying to catch a flight the next few days and they don't want to be infected. It might be that they want to go and see their grandmother who's in a nursing home and they don't want to be infected before they go in there. There are lots of very good reasons why people should wear a mask. And we want to make it okay for people to continue to wear it.
I completely agree with that. Doctor, if we can talk about one of the things that Joe Biden said the other night, this test to treat thing, when I heard him say the words, and I described it a couple of minutes ago, you go to your pharmacy, get a rapid test. If you're positive, you go home on the spot with these antiviral pills, assuming they're enough, broad enough supply. But doctor, the thing that I found odd that maybe you can resolve for me is there's no doctor in between in that process. The pharmacy gives you the rapid test, you test positive, hopefully you don't. If you test positive, they hand you the pill. Can a pharmacist do that without a doctor in the middle?
Well, I think, the way that it's set up and what's going to be really key and important is to make sure that you do not have any contraindications and reasons why we would not be giving you that particular medication. And pharmacists are actually really good at doing that. They can review the med list and you can tell any doctor who's going to be prescribing the Pfizer medication right now, we're talking to pharmacists to make sure that they can review along with them. We're reviewing all the medications to make sure that there are no contraindications. So I think that pharmacists are going to be actually very important partners in this effort. Another thing that I think should be really important when we talk about how we're going to use this test to treat approach is that, it's not only pharmacists, but the plan is also opening it to community health centers, to VA, spots and places. And I think one other thing that I've heard is, thinking about how can we do this through telemedicine. So kind of trying to improve access will be really key.
And the key to this, Bill Hanage, just so that people are clear, from my understanding, is this antiviral pill, assuming you can get it, again, in terms of production, it's critical that it be administered and taken in the first few days after you do test positive, correct?
That's correct, absolutely. And that's not unusual for an antiviral. So it's really useful to be able to link up the prescription very close to when people realize that they're infected, in particular if they are vulnerable.
Can we go to the other side of the world for the last couple of minutes here, starting with you, Bill? There was a piece in the New York Times about Ukraine, not the misery that we're all seeing every night and the heroism we're all seeing every night, but the disease dangers. There's a line, war and disease are close companions, the New York Times writes, and they talk about the polio outbreak that they've been trying to control. But relevant to this conversation, there's deep concern in light of the close quarters, the million refugees, the shortage of adequate amounts of water, that there has potential for there to be a COVID explosion on top of all the other pain people are suffering. Bill, do you share that concern?
I certainly do. Although I'm afraid you're talking to the wrong infectious disease epidemiologist in our family. My wife does a lot of work in Ukraine,
oh, really?
So we know the area pretty well. But we've been seeing reasonably large amounts of infection there and in other parts of Eastern Europe. They have some of the worst per capita mortalities in the world already, and so with the disruption that is accompanying the invasion, you can expect there to be more infections and, yes, more severe outcomes. And it's going to be more difficult to treat people because of the fact that healthcare has all of the additional disruption. I think it also should be remembered that Russia is also able to have outbreaks of Omicron, and that's maybe influencing what's going on the ground there as well. War and pestilence really do go together.
Do you have a final thought on that, Doctor? It seems to me it's too late for prevention. The bottom line is hopefully treatment, I guess, as soon as is possible.
Yeah, no, I think, it's a humanitarian crisis, and it's going to be so key to provide support as much as possible. And, the critical tools, vaccination and trying to provide access to care is going to be really key.
Sabrina Assoumou, Bill Hanage, I really appreciate your time, as I always do. Thanks so much.
Thanks, Jim.
Thank you.